I'm Dr. Edith Bracho-Sanchez. I am a pediatrician at New York-Presbyterian, Columbia University Irving Medical Center. We are definitely seeing an uptick in respiratory illnesses, including but not limited to RSV. Unfortunately, they came earlier than we're used to, and they came in higher numbers this season. RSV can affect anyone, any age, but the people who are most likely to develop complications or develop severe RSV are kids under 6 months of age, and those kids who were born prematurely, kids who have respiratory conditions, kids who have heart conditions, as well as elderly people above 65 or people who may have an immune system that might be compromised. RSV presents like a lot of other respiratory illnesses with some congestion, some cough, some feeling under the weather, sometimes fever, but not always. And RSV tends to be incredibly contagious. So anyone who is coughing, who is sneezing, can transmit the illness up until 8 to 10 days after the beginning of the symptoms. And unfortunately, RSV lives on surfaces for quite some time. So that hand hygiene, that wiping is so important to prevent the transmission of it. In addition to RSV, parents should be on the lookout for really any other respiratory illness right now. We have a lot of kids who are getting colds. Most of them are totally fine at home. But anytime really that we are beginning respiratory season, it's important to know the signs to look for medical help, and it's important to know who to call. So have your pediatrician's number at hand. Make sure that you know how to contact us. So hard to tell the difference between RSV, COVID, and flu, even for us as physicians. So honestly, as a parent, know that most illnesses, when they're respiratory illnesses, when we're in cold and flu season, most kids are totally fine at home, but always be on the lookout for difficulty breathing, a fever that lasts longer than 3 days, or a fever in a kid who's younger than 2 months, and then a child who's getting dehydrated, or anything that doesn't feel right to you as a parent. And reach out for help if that happens. We typically see RSV and other cold flu viruses in the fall and into the winter and sometimes spring. Usually, we start to see the numbers go up in the late fall and peak in February, right in the winter. Unfortunately, this year we're seeing really high numbers in early fall, which is unusual. And we know that last season, we even had high RSV activity, or a lot of kids coming down with RSV, even in the summer. So really right now we are a little bit off season. We as pediatricians know what to do for kids who are having complications or having a severe RSV illness, or really any other respiratory illness. The problem right now is that we're having so many kids come in with these illnesses at the same time. For us as parents who are hoping to protect our kids, so the first thing to make sure, and it sounds silly, but you have to make sure that your child is sleeping well and eating well. Those are the two things that are really going to bring up that immune system and make sure that if they are infected or exposed to RSV or any other virus, that their immune system will be able to combat it and that they'll be able to stay home. Now, some kids have really small airways. It doesn't matter what we do as parents. Unfortunately, they're going to contract some of these viruses and they may even develop a complication. It is so important that as a family, we make plans right now for what we're going to do if these things happen, and that we have a discussion about the adults that are around young kids. So any adult who is around a newborn baby and is experiencing cold, flu-like symptoms should stay away from that young baby during this high cold flu RSV season. You should seek medical attention if your child is having difficulty breathing, if they're breathing fast, if they're looking like they're having a hard time catching their breath. You should also seek medical attention if your child appears to be getting dehydrated, if you're not able to get enough fluids in, and if they're not peeing the way that they usually pee. If your child has a respiratory condition at baseline and then they get infected with some of these viruses, you might see that your child may begin wheezing or have faster breathing or harder time breathing, those would be reasons to also seek help. And anytime really that something doesn't feel right to you as a parent, call us. Perhaps you don't necessarily need to run to the emergency room if some of these other things are not happening, but anytime something doesn't feel right, make sure you have a way to contact us and we can discuss whether you actually need to come into the office or go to the emergency room. Perhaps you can even stay there. It's really hard to know what's going to happen the rest of the fall and winter, but I think we're going to continue to see high levels of RSV circulating in our communities. We are also going to have flu begin to circulate soon and even higher levels than we have seen. And we might have a wave of COVID-19 circulating in our communities, in addition to cold viruses that we don't often test for. So right now, the most important thing you can do as a parent is make sure your child is getting good nutrition, enough sleep, that they know how to wash their hands, when to wash them, and make sure they're in that routine. And then that you have a way to contact us should any of this come up, and should you be concerned about anything going into the season.